All right, good morning, everybody. Thank you all for being here and taking time out of your busy days to talk with me about picky eating. My name is Kate Liggett, and I am a clinician at Trumpet Behavioral Health. I've been in the field of applied behavior analysis for the last 5 years and have had the opportunity to help implement food tolerance programs as a therapist, running one-to-one therapy with my clients. And over the last 2 years have earned my board certified behavior analysis credential to be able to help implement treatments for picky eaters and to be able to help train families. So I'm very excited to be talking about this today. I'm going to go ahead and go through the presentation, and we do have some time towards the end to discuss any sort of questions that pop up. So anything that you're having lingering questions about, don't worry, we'll have time at the end. So with that being said, let's go ahead and get started. All right, so we are going to be talking about the following items. We are going to go over exactly what is a picky eater and be able to identify any types of characteristics of food that maybe you or I haven't taken the opportunity to consider in the past. We are going to review strategies and guidelines to increase food acceptance. We will go over how children are often exposed to different types of food, and the bulk is really going to be introducing new foods and strategies and methods to do so. And then finally, we will end with tips and tricks to setting up your child for success. So when we're talking about picky eaters, we really see picky eaters who only consume selected foods. And by this, we mean foods that are strongly preferred based on various characteristics that we'll talk about in the following slide. We are also talking about picky eaters eating only certain types of brands. So maybe a child will accept food that is a chicken noodle soup from Campbell's, but when they order chicken noodle soup at a restaurant, you see some aversion to accepting that food. And so eating only certain brands is another example of picky eating that we see. And then a third area where we see picky eating is actually due to evoking any sort of challenging behavior if a child is requested to try new foods. And so all of the different types of picky eating can really be broken down into those 3 domains. We will see picky eating, sometimes it can start from infancy. Sometimes it's due to being easier to consume certain foods than others, and also due to past history with being exposed to food. And so when we're talking about why picky eating behaviors have evolved, it can really be broken down into 2 main domains of biological and behavioral. And so when we take the example of difficulty as an infancy, you know, maybe this is due to some sort of biological factor such as poor oral control or due to any sort of allergies and food intolerances. But there's also a behavioral component. So maybe the child has learned that by engaging in problem behavior, they are soon offered a preferred food after being exposed to the non-preferred food. And typically what we see is a combination of both biological and behavioral factors that contribute to having a picky eater. So different types of characteristics that we see of food include colors, texture, shape, taste, and presentation. So presentation is one that often isn't a common characteristic that you would think of. Maybe a child will accept cheese, but if it is presented at the store as a sample placed on the end of a toothpick, they may not accept that type of presentation of the food. So when we're looking at different characteristics of food, it really comes down to having a narrow range of food that is typically nutritionally inappropriate. And one example I have is I've worked with a kiddo for the last 5 years, and her diet consists of bagels and apples. And so that's something where, you're getting just a limited nutritional range, and it's important to address any sort of picky eating to be able to set up a child to be able to grow and develop with the nutrition that they require. Once you have determined that a feeding problem exists and you start to see some sort of signs, you can start with generating some goals to move forward with the next steps in treating a picky eater. So some examples here include, I want my child to eat more fruits and veggies, or I want my child to tolerate different foods. And these are wonderful examples. However, it's always going to depend on the individual. So some questions you can ask yourself when thinking about your own child are, what do you want your child to be eating? And how would you like mealtime to go? Would you like it to be pleasant and calm? Maybe there's so much challenging behavior around mealtime that your first stepping stone goal is that I want my child to tolerate sitting at the table for an entire mealtime. And that is a completely appropriate goal because it's specific to what that individual needs. And that's really important to consider. Additional questions are, where does your child eat now and how long do they stay at the table? Maybe your child will tolerate accepting novel foods. However, maybe it takes them 2 hours to get through a mealtime. And so an appropriate goal for that type of individual would be, I want my child to consume a meal within 20 to 30 minutes. And so just continuing to think about what those goals look like and what the specific behaviors are to that child are going to help to generate those goals. The very first step that needs to happen once you start formulating a goal for your child to accept new food is going to be to rule out any sort of medical problems. And as we talked about that biological factor, this includes allergies, poor oral motor control, stomach issues, and dental issues. So it's important to remember that no behavioral intervention is going to be effective if there is a medical underlying problem. And so no board certified behavior analyst should intervene behaviorally because it's not going to be effective. And so this is something where the BCBA should coordinate care with some sort of medical doctor, preferably the child's primary care physician, in order to rule out any sort of medical problems before moving on to treat a picky eater behaviorally. The next thing that is going to be really important is to consider your child's specific history. And so different things you can look at include, have they always been a picky eater, or was there one specific moment where you realized that picky eating was starting to occur? Do they have a need for sameness? So do they eat the same thing for lunch every day? And is mealtime so stressful to the family that new foods are not even introduced? So it can be very time consuming and frustrating and emotional to try to introduce new foods to a child who is a picky eater. And it's really important to think about your child's history and all the times that you've tried to introduce and expose them to other foods, and really analyze your behavior as a parent as well, and look at parent readiness in moving forward to help treat picky eating. You're also going to want to consider your typical routine within your family and ask questions such as, is your child hungry? Is your child allowed to eat throughout the day, or are there structured meal times? Grazing throughout the day can actually teach a child that they will get access to a preferred food later on, and will actually not be as likely to be motivated to try new foods if they're not hungry. You can also consider things like, is your child drinking a lot of liquids before mealtime? Where does your child eat? Things like that really help to identify what's currently going on during mealtime and help you set up goals to address any sort of barriers that are existing within the routine. And the fourth strategy we have is to start a food diary, especially if it's very frustrating and meal times can be just a stressful time in your day. Having a food diary allows you to note the day, the time, any sort of fluid and food that was consumed, and the food that was presented. You can include notes on challenging behavior, you can include notes on the types of food that you've tried, and it allows you to have a log and a history to look back at and just be able to have a plan moving forward and be able to track all of those attempts. So we've covered medical barriers, your history with exposing your child to food routine, and a food diary. So thinking ahead, we are going to start talking about food exposure and strategies to help introduce new foods. So think about, out of any of these future strategies, what have you tried before? What of the future strategies do you think will be most difficult to implement? And what will be the easiest for your child? So in addition to that, I mentioned parent readiness is a factor that is really going to help set up your child for success. So think about your own behavior as well and consider questions such as, how comfortable are you seeing your child miss a meal or seeing your child get upset? Because those are things that may happen depending on these future strategies that we are going to discuss. So just identifying how you feel can really help avoid any of those potential barriers. We're going to jump to talking about food exposure a little bit. So where do kids get exposed to new foods? We know that kids are exposed to new foods through TV ads, billboards, and social media. And preschoolers see an average of 3 fast food ads per day. So kids are exposed to all of these malnutritious dietary options. And there's actually a study that showed toddlers in a preschool program who were just exposed to food. They got to play with food over 4 different weeks, and that group of preschoolers touched and tasted more vegetables overall compared to the group that did not have that same exposure. So exposure is extremely important. And this statistic just kind of blew me away. 29 to 38% of kids' diets consist of fast food as their main source. So just knowing that an average parent presents a new food 3 to 5 times before giving up, we can see that exposure is extremely effective. But a lot of this exposure is coming from those more selective, malnutritious options. And so it's important for kids to continue to be exposed to the foods that you want to see them consume, so that you're meeting all of the negative options with the more positive options as well, and can even out the playing ground of that exposure. All right, so we'll move into introducing new foods. And so one strategy that can be very effective is setting a routine for meals. And you can have breakfast, lunch, dinner, and 2 snacks, but you can also do whatever works for your family. If your family is more of an eat on the go kind of a routine that you have, do what works well so that your child can be set up for success within the routine of your individual family. Should meals be at the table? That's something where, we talked about with challenging behavior. Maybe you just want your child to start eating novel foods and you're okay with them walking around while they do so. Should there be a time limit for how long the child gets before mealtime is over? So timers are a great resource, and you can set up an expectation of meals are done when the timer goes off or when your food is consumed. And so this would be a strategy that you can implement if you're somebody who's okay seeing your child miss a meal, because if that timer goes off prior to them finishing their entire meal, then they would have to wait for that next set of meals to be presented later in the day. You can start with foods that your child used to eat and build off of that. And you can introduce foods that are similar in color, texture, and shape. When you're reintroducing foods that your child used to eat, think about if there's a reason why they stopped eating it that you can think of. And again, this is a great reason why using a food diary can be a great resource, because you can kind of backtrack back to that time where maybe they stopped tolerating a certain preferred food. All right, so when introducing foods that are similar to what they will currently accept, we have a couple examples here. The first one is goldfish. So they're orange, crunchy, salty, melt in your mouth. You can introduce similar items such as Cheetos or orange veggie straws. And then ask yourself, would you then go to introducing a carrot? I think this example depends on the individual. So if the individual is only eating orange items, then yeah, maybe you would go to a carrot. It's crunchy, it's orange. However, it doesn't really match the same taste as a goldfish. So if the child is really fixated on having the same taste, then maybe you'd hold off on introducing a carrot at that point and kind of build up to slowly fade away from those crunchy, salty options to work up to a carrot. The next example is chicken nuggets. So they're breaded, soft, brown, salty, easy to swallow. Maybe next you would introduce French toast or fish sticks. And then would you introduce mashed potatoes? I think this one is a little more apparent that it's not a very good next step for that child. The texture is completely different from a chicken nugget, and so I would continue to introduce more foods similar to French toast and fish sticks before you move on to introducing something that it appears different, the presentation is different, as well as the texture is completely different. Okay, so when introducing new foods, you can use a first then method. So new foods should be introduced in very small quantities and then paired with preferred foods. And there are actually two ways to do this. The first way is very literally first then. It's kind of that same methodology of first finish your dinner, then you can have your dessert. And so this would be where you first present a small amount of food and immediately follow it by a preferred food. So you're first introducing that non-preferred option and then going to a more preferred option immediately after, and it would be a bite for bite ratio. Another way you can introduce this is what we call simultaneous pairing. And with that, we mean you're going to introduce the non-preferred and the preferred food option at the same time. And so as an adult, this might not sound the most appetizing. I've seen this with vegetables and yogurt, and so sometimes that taste doesn't exactly line up, but you're going to slowly increase the ration of the new food to the preferred food. So you're starting with such a small ration of the new food that sometimes it's not even visual to the child. And so when you're continuing to build on that, the majority of that taste is going to be the preferred food. And then of course you want to slowly decrease the amount of preferred food as well. It's important to remember that it takes at least 10 presentations of a new food for a child to accept it. So again, going back to parent readiness, knowing that it's going to be a time commitment and having that routine strategy in play is really going to help set up that time for both the parent and the child to be ready to commit to multiple presentations of that food. Different Tips and tricks that you can use to introduce new foods are taking your child to the grocery store and having them help pick out the food with you. You can have them help cook with you. You can have them observe you eating other foods. All these examples help with that exposure to help combat all the exposure for the foods you don't want your child consuming as often. So just allow them to be around that food, even just having them play with that food, touch it, maybe not even starting with the expectation that they take a bite of it, can just be ways to slowly help integrate new foods into their day-to-day routine. You can try a new presentation of the food and see if that's something that's effective. You can also offer choices, so allowing the child to be a part of what those expectations are and asking, would you like to take 1 bite or 2 bites of the food? And so they're a part of that decision making as well. And then just remembering to always reward trying new foods and provide praise for those appropriate behaviors. So some of those praise remarks might be, oh my gosh, you tried corn today. That's wonderful. But it also might just be, like I was mentioning, tolerating sitting at the table. Thank you so much for sitting at the table, and just being really excited about that. And then making sure any sort of inappropriate behaviors are ignored during that time as well. Avoid labeling your child as a picky eater. Children will live up to their expectation. And so if you label them as a picky eater, you're going to create a barrier for them that they can rely on to avoid accepting new foods. Watch how you respond to challenging behavior and really pay attention to how you react to that environment as well, and avoid giving up too soon. So know it's going to be a time commitment and it's going to be something that you continue to increase slowly day after day, but it's not something that you can flip a switch and it'll be better tomorrow. So avoid giving up too soon and really make sure that you're on board to continue implementing whatever intervention and strategies are working for your child and continue to see that out. And then if you are currently working with a clinician, connect with them to come up with an individualized plan. So just make sure that you are working with a behavior analyst or if you also have other providers like a speech pathologist or an occupational therapist, really working to have all of those different providers on the same page, as well as the treatment that's going on in home, because that consistency is really going to set up the child for the most amount of success. All right, well, thank you very much for listening to this presentation. If there are any questions, I would be more than happy to help answer. All right, can I do these multiple presentations on the same day? Can I just keep introducing the same plate during the day? I would say I would stick to one method at a time and see how effective that is to carry it out. So let's see. If you are, it depends on your individual goal. So if you're trying to focus on what a specific food to have your child accept, I would say absolutely. Go ahead and for breakfast, lunch, and dinner, introduce the same food every day. But again, consider if you're somebody who's okay with seeing your child skip a meal, because if you introduce other options throughout the day, then they're going to learn, I just need to wait out until I'm done with lunch or until I get my afternoon snack, and then they get something different. Great question. What if our baby chooses but doesn't want to eat what he chooses? So if they make a choice and you give them options, which one would you like to have for lunch? Let's say it's 3 different options of fruit, and they select something that they prefer, then I would say it's really important to make sure that you follow through with having that one item and teach that individual when they make a choice, what a choice is. The choice is that now that's what's going to be presented to you. And so if he doesn't want to eat it, I would continue to repeat a very simple instruction: take a bite, and continue to do that until they tolerate it. My son won't eat textures like mashed potatoes, but will eat rice. Should I introduce mashed potatoes after rice? You can. I'm trying to think. Maybe noodles would be something that's a good in between. So they're, a little softer. And so maybe you consider other types of food that has that stepping stone to mashed potatoes. You can also try that simultaneous option and having a one bite size of, let's see, he will eat rice. So I would say have the majority be rice with a little bit of mashed potato mixed in, and you could try slowly decreasing the amount of rice and increasing the amount of mashed potato, but have both items on one spoon. And that would be a way to implement that simultaneous pairing. Another thing that you can do is if you have a food that's really preferred, you can ask your son to first take a bite of mashed potatoes, then you can have a bite of whatever that preferred food is. And then you would just have to wait him out until he accepts it and consumes it. And then he earns a bite of the preferred food. When you offer the new food with a preferred food, is it offered on the same plate or is it one and then the other? So this is a really good question. I would say to start, when you're presenting new food, have a very small amount on the plate. And so when you have a new food, when you offer the new food with the preferred food, same plate or one and then the other. I would say to always have the preferred food within sight, but out of reach. And so maybe what this means is you have one bite of non-preferred food on the plate. There's nothing else on that plate during dinner except for that one bite. And again, that's going to set up those expectations for the child. Oh, I only need to eat this one bite. And then the other preferred item is out of reach, but within sight. So they can see that it's available for them to earn. But at the same time, they could be faster than you and get access to that preferred item without having to eat the non-preferred. Good questions. What do you do when a child gets upset and cries when asked to eat a new food? So I would think about the environment and say, are you comfortable with your child sitting and crying during mealtime and kind of waiting them out? If that's something that you're not comfortable with, then the child is going to learn more and more opportunities when I cry and get upset. Then I get to leave, or then I get the preferred food item. So the more times a child is upset and you continue to remove the non-preferred item, the more teaching opportunities they have to learn. All I have to do is get upset and cry, and then I get what I want. So I would start with having those really small portions such that it's a little more manageable for the child to understand what's expected of them and see if that helps. And I would try things like, even before you get to the table, telling them, hey, what do you want to have if you do a nice job eating your non-preferred food? And using all of this to talk about before you actually get to the table might actually set up the environment to decrease the amount of crying and other upset behaviors that you see. Oops, went a little too far. If my son doesn't eat a certain preparation of a vegetable, but will eat it steamed or raw, how do I get him to move on to the cooked vegetable? So we see this a lot, and what I would say is you can start to mix them together and see if that's something that helps to increase the tolerance. Again, you can offer some sort of preferred item after. So clearly it's more difficult for that child to accept a different preparation. And so making sure that you have something really preferred after he tolerates that non-preferred is going to be really motivating for that child. Good questions. If my child insists on having the same meal on dinner and refuses what I offer, can I make him sleep without dinner? My husband suggests that many times, and I always got soft and bring him what he requested, cereal. So this is really up to your parenting decision and what you're comfortable with. What happens is if a child misses a meal, he's going to be that much more motivated by being hungry. That's our natural motivator, is hunger. So if he is that much more motivated in the morning, I would say, you know, if you're able to start to see acceptance of non-preferred foods and he ends up going to bed without dinner, then you're making progress with the food. But it's really something that I think consistency is going to be very effective with. And so talking with your husband and making sure both of you are on the same page, it can be very difficult to see your child engage in those upset behaviors or tolerate missing a meal. So it's definitely not an easy thing to consider. But at the same time, if he gets access to his preferred item, essentially what he's learning is that you know, he doesn't need to consume the non-preferred foods because within an hour or 2 hours later, that preferred food is presented. So that's taking away the motivation that he needs to accept it. My son wants to eat pizza every day for dinner. How can I break this behavior? I would, again, start small. It's really important to meet a child where they're at. And so if he wants pizza every day for dinner, maybe you can tell him, sure, you can have pizza for dinner. First, I need you to finish this carrot, and then maybe 3 carrots, and then 4 carrots. So now he's eating carrots before pizza. Then you can do the same with something else that you would prefer that your son be tolerating, and then he gets the pizza. So if he's really that motivated for pizza that he wants it every day, you can start to increase the amount of food he's consuming before the pizza, and then start to decrease the amount of pizza that he's eating. So maybe he eats 2 or 3 slices of pizza. I don't know how old he is, maybe he eats 1, but you can continue to decrease the amount of slices. If he only eats 1 piece of pizza now, and maybe you cut it up, you can decrease the amount of bites. And so you start to offset the amount of pizza consumed with the items that you prefer. For the first then method, how long do you introduce a non-preferred food? For 5 minutes? Yeah, really great question. Excuse me. So I would continue to introduce the food by saying, take a bite. I always recommend avoiding stating a question if something's not a question. So I wouldn't say, can you take a bite? Can you open up? Can you finish your food faster than me? All of these different questions, you're likely to know the answer to. If your child can physically chew his food and swallow it, he can take a bite. And so I would change that verbiage to say, take a bite, and ignore all other behaviors except for representing that instruction, take a bite, every 30 seconds. And I would, if you use it, I would use it for the duration of mealtime, because as soon as you kind of back off and give him something that he would prefer more so, you haven't followed through with that instruction. And so again, it's another teaching opportunity for the individual to learn, oh, well, mom or dad is going to say, take a bite, but if I wait them out 5 minutes, 10 minutes, eventually I get what I wanted. So I would recommend continuing to repeat that for the total duration of mealtime And it might take a while. So I would plan the first time you're really trying to introduce a new food to have, a couple hours, maybe 2 hours that you are dedicated to sitting at the table, because it might take that long to start with. How does the child's need for control play into this? I have a 4.5-year-old who has always needed protein to help manage impulsive behaviors. This has led to lots of grazing and him being able to choose his protein choice. Now he explores food when he wants, but he has to be the one, to have the idea to try it. And now we are at a place where he doesn't eat the same meal with the rest of the family. Sure, so you can use his choice as motivation, similar to the pizza example. So you can use his choice. Sure, you can have your protein first and then offer that non-preferred food. Take a bite of whatever that is. Again, using strategies like keeping it really small. So if he has one bite of the non-preferred, maybe then he gets the entire protein bar or egg or whatever his protein choice is, and then slowly fading the preferred food out and increasing the amount of exposure with the non-preferred food. My child seems to have an aversion with green foods. Any food suggestions to start with? She likes mostly blanched, crunchy foods. Bland, crunchy foods. You could start with, the first thing I considered is kale chips. They're green, but they do have the same texture and the same taste as other chips. Again, maybe mixing in potato chips with the kale chips and having a bite for bite ratio might be something that helps. Green veggie straws would also be something else that you could introduce. Let's see. And any sort of vegetable that is green, you could also start by coating it in a preferred sauce as well. So if she likes ranch dressing or something like that, maybe covering it to the point where it's no longer green. And again, it's a small bite. I wouldn't give a full bite of broccoli. I would give a manageable amount, but then starting to decrease the amount the sauce covers and increase the bite of that green vegetable might be some strategies that help. How do you handle gagging when presenting new food, no matter the quality? Preparing food in front of him is a challenge. Okay, so gagging, it can be a biological factor. It can also be behavioral. I have observed children engaging in vomiting. They make themselves vomit when they're presented with a new food. And what I do within a therapeutic setting, and I have trained parents on this as well, is to get a trash can and to have it next to you. And if you've presented the instruction to take a bite, or if even just preparing food in front of the child is a challenge, tolerating them just being in the kitchen for a certain amount of time. Maybe that time starts with 10 seconds and then they get to leave, and then increasing it to 30 seconds once they're able to handle it, and just slowly increasing the amount of time they're able to tolerate being around prepared food. But when you do get to a point where you're introducing it for consumption, saying something like, take a bite, and letting them know there's a trash can here if you need it, and then just being able to follow through. If it is medical, though, that's definitely something that you would address with a primary care physician. And that being said, maybe it's handled in a different way. When ruling out medical issues, how can parents request tests for poor motor control from their PCP? I'm not quite sure exactly what type of tests you would request. I think that would be a question I would divert to a PCP, and just let them know, hey, I'm interested in starting food tolerance with my child, and we see these poor motor control skills, and so what They can do a test, but they can also write up a report too based off their observations. And so work with your behavior analyst and determine what sort of documentation needs to go between those providers. But I don't know that it would be a specific test. And if it is a specific test, I would ask your PCP. One of our goals is to have our son stay at the table, and we find it disruptive for him to keep getting out of his seat. Ideas, use of timer. Sure, I would maybe start with just using a timer to find how long is he staying in his seat for. And just track it without intervening and asking him to stay at the table longer. And this allows you to just get a baseline for how long he is tolerating sitting at the table. And then after, maybe 5 different meals, I would say do this for at least 3 different meals. You could do it throughout the whole day, across 3 different days, however long you would like to kind of have enough information to go off of. And once you have that amount of time, what you're going to want to do is set the requirement below his average. So if your child has an average of sitting at the table for 15 seconds before he gets up to do something else, I would start that first level at 10 seconds and saying, okay, you can sit at the table for 10 seconds and then you can go. And once he's able to do this, maybe across 3 different days at all meetings or at all meal times, then you can introduce the next phase of that and say, now it's 15 seconds, then increase to 30 seconds, a minute, 2 minutes, and slowly build up until your child is sitting at a socially appropriate amount of time at the table. And then you're also going to want to make sure you're letting him know that he did a good job. And even though 10 seconds is not socially appropriate for that first phase, it's obviously a skill that your son has a hard time fulfilling. And so letting him know even at 10 seconds that he did a good job, because you want him to learn when he follows through with the amount of time that he is able to receive that praise and that attention from you as parents, and that's going to generalize to those longer durations once it is socially appropriate at 5 minutes or 10 minutes. Great questions. What if I try to introduce a new food, but then he attempts to vomit or gag and protest of trying food? Do I continue to introduce new food or allow him to vomit and gag? I would say, again, this is up to how you feel about your child getting upset when new food is introduced. And if it is to the point where, you talk to your PCP and let them know he's vomiting, and it's to the point where he's not getting enough nutrition due to this, then I would definitely move on per their recommendation. But if it's in one setting, I have worked through vomiting and gagging to reduce it. And sometimes that consistency is all that needs to be brought to their environment in order to decrease those behaviors. My son has a recipe book and always wants his recipes from the book. Is it okay if I prepare the recipes from the book, or should I make him eat what I prepare for the rest of the family? Well, I think eventually, and I don't know how old your son is, but, he's going to have to consume foods at school in a cafeteria. And if he is older, you could use a strategy to say, if that's what you want to eat, let me help you make it. And that way you're only preparing one meal for the rest of the family, but then you're also teaching your son some other strategies to set himself up for success as a young adult and things like that. If he's younger, again, if there's something that he's that motivated for, use that to capture motivation and to say, sure, we can have this from your recipe book tomorrow night. Tonight we're going to have this, and just try to slowly introduce foods that he can tolerate with the rest of the family. What about when a kid is nonverbal and is hard to explain or give options? Wonderful question. With that, I would present the actual food items in front of them and ask them to pick one And so whatever item they touch, that is the behavior that indicates to us within society that you made a choice. And so I would teach your child, if you're just working on giving options, maybe don't even start this when it applies to picky eating and food tolerance, but maybe just start this concept practicing outside of that, where you present 3 different toys and teach them the one that they touch is the one that they get to play with. If they're showing signs that they didn't actually want to play with that, so maybe they start to get upset or whine or cry or throw the toy, you can represent all of those options and help teach them by pointing to the one they're showing that they actually wanted. And so by teaching how to make a choice by touching different things, I think is a really important skill, especially if your child is nonverbal. Okay, my son is really bad about throwing foods he doesn't like. What can I do to stop this? So I think having a really small amount of food is going to help keep your kitchen a little tidier. Only present 1 bite at a time. If you present an entire plate and you know your son has a history of throwing foods, that whole plate is probably going to go across the kitchen. So only presenting 1 bite of food at a time. And then I would also have another plate next to you out of reach from your child that every time he throws food, you're able to represent the same item and the same instruction. So essentially what you're teaching him is no matter how many times he throws the food, you are still going to present the same amount of food, so he's not escaping that instruction. And so just have the entire plate of dinner next to you and just present 1 bite at a time. You might still have bites of food throughout your kitchen, but it's going to increase, it's going to be a lot harder for him, right? So he has to then throw, you know, maybe 50 pieces of corn, and maybe he'll stop after, you know, 20 or 30. However, had you given him the entire plate, he would have thrown the entire plate of food anyway. And so you might need to be prepared that your consequence might be the same for a while. You're still going to have to pick up food for a while, but by changing your behavior, you're increasing the amount of throws he needs to engage in, and that might be enough to decrease how often he does it. And then once you start to see that decrease in throwing, start to increase the amount of food that you're putting on that plate. How can I help my toddler gain weight? So when it comes to picky eating, I think any of these strategies you can definitely try and see if they're effective. In terms of the types of food that they should gain, I'm going to direct that question to a PCP. I'm not a nutritionist and wish that I could answer that question a little more thoroughly, but I'm going to leave that one up to the experts. All right, what would be a good schedule for meals and snacks? How many hours in between each? This would probably depend on how old your child is and the size of their stomach, how quickly they metabolize foods. But I would say maybe having a set time for breakfast, lunch, dinner, and then maybe a morning and afternoon snack. That way, every couple hours, you're representing food and have another opportunity to teach and increase that food acceptance. So, wonderful questions. I think that's the last one I see on here. So thank you very much to everybody who has logged in and been a part of this presentation. Thank you to Advocacy Denver and Trumpet Behavioral Health for helping to create this presentation. And I appreciate all of your time today. Thanks so much.